with its characteristically rapid and chaotic electrical activity leading to uncoordinated atrial systole. Atrial fibrillation is seemingly an impulse that has lost its way. Atrial fibrillation is a complex interaction between initiating triggers and an abnormal substrate capable of sustaining the arrhythmia. Atrial fibrillation is a progressive disease that may result from the cumulative impact of electrical and structural remodeling of the atria. Electrophysiologic remodeling may be related to calcium overload in myocytes and include shortening of atrial refractory periods. Electrical remodeling occurs within a few days, contributing to the persistence of atrial fibrillation. Structural remodeling, in turn, is the progressive expanding of the atrium that results following contractile inactivity, which eventually leads to blood stasis and pooling. Remodeling affecting atrial functioning can begin within 1 day. Structural remodeling contributes to cardiomyocyte degeneration and, importantly, to the decrease in cardiac output. Early on, if sinus rhythm is not restored and maintained, atrial fibrillation may become permanent. Indeed, the ability to reestablish and maintain sinus rhythm is dramatically reduced in patients who have been in persistent atrial fibrillation for more than 12 months. The increased risk of clot formation, microemboli, and stroke is well documented. Additionally, apart from stasis, atrial fibrillation may confer a hypercoagulable state, evidenced by elevated plasma concentrations of fibrin, D-dimer, beta thromboglobulin, and other prothrombotic markers. Moreover, elevations of interleukin-6 and C-reactive protein suggest an inflammatory state exists among typical patients with chronic atrial fibrillation. The hypercoagulable state conferred by atrial fibrillation may become more pronounced as episodes lengthen. Stroke is the most feared complication of atrial fibrillation. In addition to increased risk of stroke and mortality, many patients experience palpitations and angina. Over time, left ventricular function may be compromised, leading to dyspnea, impaired exercise tolerance, and fatigue. The cardiomyopathy induced by atrial fibrillation begins within weeks and may become irreversible. Research into the mechanism and effects of atrial fibrillation continues to provide important insights regarding the potentially devastating nature of this disease. When considering strategies, the decision to leave a patient in atrial fibrillation and control the heart rate while not restoring sinus rhythm may mean the patient remains irreversibly in atrial fibrillation.